Hi again. I thought I would do a video today on thyroid problems and fertility. So, what is your thyroid? Your thyroid is a butterfly-shaped gland that sits just below your Adam's apple, and it produces and regulates hormones within your body that regulate your metabolism. The thyroid also regulates reproductive hormones and the speed with which your body cells and your organs function. So if your thyroid gland tells your body to produce cells or to work too quickly, then you'll have hyperthyroidism. And if your cells and your organs and your hormones function too slowly, then you'll be hypothyroid. The main cause of thyroid problems is related to an autoimmune condition, which means that your cells in your own body attack the thyroid gland and cause it to self-destruct. It's important to note that it can run within families and usually within the females of a family. So it's something that if you are concerned about your fertility, I would get yourself tested for a thyroid problem and I would ask family history to find out if anybody else in your family has had a thyroid problem. Okay, so with that said, how does having a thyroid problem affect your fertility? Well, if your thyroid hormones dictate all the other sort of running of your body, it's like your management system, then it means that your reproductive hormones won't necessarily be balanced, and everything sort of needs to be balanced. It's quite an intricate system of things, sort of a chain of events to happen to ensure that a pregnancy occurs and then is sustained. So if your reproductive hormones are unbalanced in any way, then that's going to cause problems with trying to sustain a pregnancy. Having a thyroid problem can also mean that it disrupts ovulation, which means it's going to be difficult to get pregnant in the first place. And it can also mean that the second half of your cycle can be too short, which means that it won't support implantation of an embryo. If you have hypothyroidism, then your core body temperature can be a lot lower than it should normally be, which means that it will affect cell division of an embryo and therefore will stop it from developing into a pregnancy. So that's something to also consider. So that's how the thyroid problems can affect fertility. Thyroid problems can also affect the continuation of a pregnancy and they can cause miscarriages. So a baby doesn't have a thyroid that functions for the first 12 weeks of its life. And so it uses the mother's supply of thyroid hormones. And if your thyroid hormone levels are unbalanced in any way, then there may not be enough thyroxine within your body to sustain a baby's supply as well as your own, and therefore it can cause a miscarriage. So they're sort of the reasons why it's really important to have your thyroid levels checked, and if they are unbalanced in any way, to have them sort of artificially treated. So the symptoms of thyroid problems can vary. They're all quite subtle symptoms on their own, but when put together are sort of the classic symptoms of a thyroid problem. If you're hypothyroid, then you'll find that you may be tired all the time. No matter how much sleep you get, you won't be refreshed. You might have cold hands or cold feet. They were the signs that I displayed. You might have hair and skin changes, so your skin can be extremely dry and scaly. You can lose hair or thinning of the hair. It could be dull and very brittle and lifeless as well. You may have an inability to lose weight, a low sex drive, depression. A classic sort of sign would be core body temperature being consistently below 36.5 degrees. Recurrent infections, possibly problems with periods, but it may not necessarily be the case. I had a period every month, but it wasn't necessarily clear cut to me whether I was ovulating every month. So infertility can also be a symptom of a thyroid problem. If you're hyperthyroid, then you might be irritable, have mood swings, difficulty getting to sleep, and tiredness as a result of that, muscle twitching, unexplained weight loss, irregular or fast heart rate, persistent thirst or need to go and pee. That was also a warning sign for me. I was thinking I've never had an issue with that, but that is something that rang alarm bells for me. Again, a low sex drive, red palms of your hands, excessive sweating, loose nails, your nails can come away from the nail beds, eye problems or vision problems, and then a classic sort of hyperthyroid symptom is a lump where your Adam's apple is. Okay, so if any of those sorts of symptoms are ringing alarm bells to you, I would suggest that you go to your GP and you ask for a thyroid function test, and you want a full panel. You will get a blood test that will look for your TSH levels and your T4 levels. Your TSH level should be between 0.4 and 4, and your T4 level should be between 9 and 25. If your TSH level is below 0.4, then you are veering into hyperthyroid territory. And if your TSH level is above 4, then you are veering into hypothyroid territory. And for trying to conceive, the ideal is no higher than 2.5 for your TSH. So it's really important that you ask for a blood test. It isn't given as standard in infertility testing, so it's something you have to sort of request specially. But it is something that should be given on the NHS if you request it. So treatment then. No matter what the levels are, you will be treated in the same way if your levels are unbalanced. So you will be given thyroid hormone replacement tablets. The pharmaceutical name is generally levothyroxine, and you take those first thing in the morning before eating anything and before drinking any sort of caffeinated drinks. You can ask your GP for a form to fill out that will give you a waiver for prescription fees. For some reason, thyroxine hormone replacement tablets mean that because it's a lifelong condition with no cure, you don't have to pay for your prescriptions for them. So that's something useful to be aware of. Whilst your thyroid levels are being treated and balanced, then you need regular blood tests every 4 to 6 weeks to see what's happening with those levels and if they're starting to become more balanced. I would personally avoid trying to conceive until your levels are correct. From sort of sad experience myself, I had suffered from infertility for over a year, and we were on the path to IVF, and I managed to get pregnant, but sadly my baby died, and we think it was a thyroid related issue because my thyroid levels were not controlled. I wasn't on any medication at that time, and by the time I was put on medication it was too late. So I would definitely avoid trying to conceive just to avoid heartache until your levels are balanced. Close monitoring is essential, and you should be monitored throughout your pregnancy and beyond. Postpartum, there is a risk of a flare-up, particularly for people with hypothyroidism, and a lot of the symptoms can be the symptoms that would go along with postnatal depression or just exhaustion from parenting a newborn. So once you are on thyroid medication, you should be monitored closely if you're trying to get pregnant if you are pregnant or if you've just had a baby. I hope this video has been useful to you. If you've watched this far, then you've obviously liked this video, so hit the like button. And if you'd like to see more videos from me, then please hit subscribe. Thank you very much. Bye.